Hello, my name is Tajira Lockin and I am an 8th semester nursing student. So today I'm going to be doing suctioning as well as trach care. So before doing that, I want to make sure that the patient is there's actually a lot of secretion and the trach needs to be suctioned. I also want to make sure that there's an order PRN to suction the patient. I'd want to go into the patient room. I want to make sure to introduce myself as well as to ask the patient for his or her name and date of birth. I want to make sure to provide privacy as well. And while doing that, I'm going to go ahead and do my hand hygiene. I want to explain to the patient what I'm going to be doing so he or she will have a good understanding of the procedure. While doing that, I want to make sure that I establish a means of communication while suctioning the patient so the patient could know to raise his or her right or left hand or whatever is established just in case something was supposed to go wrong or the patient is feeling any type of discomfort. I would want to make sure to listen to the patient respiratory rate, rhythm, and depth, as well as to listen to the patient lung sounds. I'd want to make sure that I'll set my suction between 80 and 120 and make sure that it's working. So I'll also want to hyperoxygenate the patient before starting anything as well. Once that's done, I'll go ahead, make sure my bed is already in a workable height. I'll want to raise it up a little bit more. Then I'll go ahead and start. I'll do hand hygiene. I'll go ahead and take my kit. I'll open it away from me. Once it's open, I'll go ahead and take my gloves out. Just kind of move that over. I'll go ahead and throw that out, making sure not to drop my hand below the waist. Then I'll go ahead, open my straw of water, sit down. I can go ahead and take my suction out. I want to make sure to keep this in my dominant hand because once I touch the patient or touch the suction, that this hand will become non-sterile. I'll go ahead and connect it. I want to make sure to hold this in my hand so it's not dangling around. I'll connect it to suction. Then I'll go ahead and test to make sure that my suction is working. Once that's done, how you said I hyperoxygenate the patient, I'll go ahead and take that off. We already established a means of communication. I'm going to go ahead and suction the patient, making sure not to suction while going in. Once I need resistance, I could go ahead and suction while coming out, intermittent. I could go ahead and suction the patient again if I feel like he needs to be suctioned again. But right now I'm not going to do that again. But also between suction, you want to give the patient rest. Once I've taken that off, I'll just kind of wrap that up in my hand. And I'll go ahead and take off the old feed dressing because I'm going to be changing the patient trach and making sure that it's clean as well. Making sure it's clean. So once that's taken off, I'll go ahead and clear my field so I could get my trach care kit ready. I'll throw that out. Then I'll make sure to provide hand hygiene again. And I'm gonna open up the kit away from me. I'm gonna go ahead and put my gloves on. I can try not to touch anything else. Once it's on, I'll go ahead and put this in the trash as well. That will be in the trash. I'll try not to drop my hand below the waist. I'll go ahead and take my drape out so I could extend my sterile field. And I'm just gonna go that way. Now I can go ahead and arrange everything. Trying to arrange everything in the middle of my field so nothing is touching the edges, because around the edges are not considered sterile. Once I have everything all situated, I could go ahead and pour. I'm making 3 different containers, 3 different compartments. So I'm gonna go ahead and pour sterile water in 2 sections. Then I'm gonna do sterile water in the 3rd. And I'll go ahead and throw that out. Then I'll add hydrogen peroxide to one of my sterile water, half. So I mixed it half and half. I'm gonna go ahead and put my sponges in just one that just has sterile water. Once that's done, I could go ahead and start my cleaning process. So I'm making sure that I'm using my non-dominant hand to take this out, because once I touch this, it's considered non-sterile. I'll go ahead and take it out. And then I'm trying to avoid putting it over my sterile field, so I'll go ahead and drop it in the hydrogen peroxide and the sterile water. Then I'll go ahead and take my cleaning with my dominant hand. Then with my dominant hand, I'm gonna go ahead and wash it over the trash. Once it's done, I'll throw that out, and then now I'll put this in the other section with just sterile water. Then I'll go ahead and use my dominant hand to take it out, knock it off just in case there's any debris on it. Then I'll go ahead and put it back in. Once it's in, I could go ahead and use my dominant hand and take out a few of the sponges that was just sitting in the 3rd compartment with just sterile water. I'll just take one and I'll just kind of wipe around. Once it's all wiped, I can go ahead and throw that out. Then I'm gonna go ahead and change my ties. Normally you can have help with this, but being that I don't have any help, I'm gonna leave my old ties on, just so if the patient was supposed to cough or anything, then it won't dislodge the trach. Go ahead and put the new one on. Then I'm just gonna raise the patient's head up a little so I can get the other one in. Once I got that, I'll just stick it. Then I can go ahead and take off the old one. I want to make sure that it has approximately 1 finger. So I could just make this a little bit tighter. But you do not want to make it too tight or too loose. So there we go. Go ahead and throw the old ties out. And at this point, I would want to change my gloves and add on new sterile gloves so I can go ahead and put on my V dressing. I'm trying to make this as sterile as possible, even though it's hard. So I'm going to go ahead, kind of use this to slide it under a little. Okay. Once that's done, I'll go ahead and throw this out, and then I'll just go ahead and make sure to connect back my patient to the oxygen. I would want to make sure to document how the patient took the procedure. If there was any type of drainage, I'd want to make sure to record that and make sure to chart that. and then that would be it.